Good morning once again. My plan to stay sleeping later this morning has obviously failed. But, on the bright side, a show about healthcare. It was on my mind. Universal healthcare is healthcare coverage that is extended to all eligible residents of a governmental region that covers medical, dental, and often mental health care. These programs vary in their structure and funding mechanisms. Typically, most costs are met via a single-payer health care plan or national health insurance. Universal health care is implemented in mostly wealthy, industrialized countries, with the exception of none other than the United States of America. It is also provided in many developing countries and is the trend worldwide. The United States is the only wealthy industrialized nation that is completely sans a universal healthcare system. Even countries such as
Argentina, Brazil, Canada, Chile, Costa Rica, Cuba, Panama, Peru, Uruguay,
I'm a guy. Are you calling me a guy?
Venezuela, Hong Kong, India, Kuwait, Qatar, Saudi Arabia, Israel, Japan, Malaysia, South Korea, Sri Lanka, Thailand, Taiwan,
all have a universal healthcare system. Even Mexico plans to accomplish universal healthcare by 2011. China formed the NCRMCS. What the hell is that? The new rural cooperative Medicare system makes health care for people of rural China affordable. The annual cost of each person in China to be covered under the NCRMCS program is about 50 yen per year. That's about $7. Of that, 20 yen is paid by the central government of China. 20 yen also provided by the provincial government. And a 10 yen contribution is made by the patient his or herself. Lovely! Soon after its implementation in China, nearly 80% of China's entire rural population had signed up for this program. I know I would. The system works on a tiered basis that allows for coverage of people to take place based on what type of procedure is involved, thereby determining how much of the payment is responsible by the patient and how much consequently responsible of the government. India also has a universal healthcare system. And the government hospitals are said to be some of the best in the entire nation. They provide treatment at a taxpayer expense, and most prescription drugs are offered free of charge. Huh? Do you like the apples? Do you like them apples? Starting to feel a little bit behind living in the States here. It seems all too easy to just up and decide that the government should provide health care to us on a national basis. But philosophically speaking, it sure seems like it would be up to somebody like a governing body to take care of the health and the well-being of its people. This begs the question, should a government be responsible for creating a national universal health care system to care for its people, those people whom it governs. I say yes, because these governmental peoples need to get their act together, said the strange man with a shirt on his head. With most of the rest of the world fully prepared to care for its people, it seems like a nation so industrialized as the United States to philosophically fall behind in caring for the well-being and health of their people, the people of the United States.
So the lowdown, logically, is this.
Every nation should have their own form of universal health care because we are all born out of causation. There is no planning involved, and thus there is no planning for someone to be taken care of. Our government and our elected officials should be those responsible for creating a system in which we can all live healthily without having to worry whether or not we have the money to stay healthy. Because after all, with all the technological advances we have, such as my being able to look up some information on a website from my phone, then I should be able to access doctors and prescription medicines just like other people in other countries get, through their government, free of charge, or with very little charge at all. And even are all then I should be squeaky. Then I should second time to fucking roll. And the United States